Good evening, everyone, and welcome to our session. I am Dr. Tarinee Puri on behalf of Voice of and I welcome you all to the session titled Empowering Informed Choices Supported by Pfizer. As the month of March has been all about highlighting women's health, through engaging panel discussions, we endeavor to shed light on the intricate role of hormones in the body and their significance in reproductive health. This campaign aims to explore the landscape of modern contraceptives and provide comprehensive insights into their mechanisms, effectiveness, and potential side effects. Furthermore, in our pursuit of empowering informed choices, we aim to debunk myths, address misconceptions, and highlight the importance of access to reliable information. By fostering open dialogue and sharing expert knowledge, we aspire to equip women with the tools necessary to navigate the complexities of reproductive health confidently. And now, with this, I'd like to welcome our esteemed speakers for the day. Dr. Nandita Palshetkar, gynecologist and infertility specialist, scientific director, Bloom IVF. Welcome, Dr. Nandita. Dr. Monika Bhatia, consultant of OBG, Venkateshwar Hospital. Dr. B.S. Susheela Rani, gynecologist, Manjushree Speciality Hospital, Bangalore. Welcome, Dr. Rani. Dr. Jamunadevi G, senior consultant, gynecology, Yashoda Hospitals, Secunderabad. Welcome, ma'am.
Thank you.
So now we'll begin with our session. The topic for today is understanding the role of hormones and modern contraceptives. So without further ado, let's begin the session. I'd like to ask my first question to Dr. Susheela. Could you please provide us a comprehensive explanation of oral contraceptives, how they work, and how they function to prevent pregnancy and their effectiveness?
Yeah, basically oral contraceptives are mainly of two kinds. One with the combination of hormones, both estrogen and progesterone, and the other with a single hormone, progesterone. Now, when we say combination of estrogen and progesterone, the progesterone is used mainly for the purpose of contraception, and estrogen helps in menstrual regulation of the menstrual bleeding. Progesterone causes changes. One, it prevents ovulation. That means it prevents the egg from being released in the ovary. It brings about changes in the tubal lining to such an extent that it doesn't allow the fertilized egg to travel towards to the uterus. And then it brings about change in the endometrial lining as well, and makes it atrophic. In the sense, it makes it less comfortable for a fertilized egg to get implanted in the endometrium. And most importantly, it brings about changes in the cervical mucus, so it doesn't allow the sperms to enter the uterine cavity. So in all these ways, it prevents a woman from getting pregnant. The main aspect would be inhibiting the ovulation, of course. Now, I suppose that should explain how these oral contraceptives work. Tarini?
Yes, ma'am. You can even elaborate further if you have to say.
Yeah. Then how efficient are they? How good are they in preventing pregnancy? Now, if they are used the way they are expected to be used, say for example, taking the tablet same time of the day, started at the same time after the menstrual cycle, not miss any tablets, then this is called as a perfect use. And if 100 women were to use it perfectly, then the chances of pregnancy is very, very minimal. A max of about one woman getting pregnant among 100, that also in the first year of contraceptive use. But if you look at women who use it in our day to day life, it's not the same. They may not be able to take it right at the time. They might miss a tablet or two, or sometimes, continue to miss tablets and then suddenly find themselves having a period in between. This is called as not the perfect use. This is the typical use, how women use it during use. In these kind of situations, of course, you cannot expect 100% efficacy of these oral contraceptives. It should be around something like 7 to 8 women could possibly get pregnant out of 100 women users. So this would be the efficacy of the oral contraceptive. So generally, I would say, if used properly, it can be very, very, very efficient in preventing pregnancy. Not just that, it can have a host of other benefits. Anything else you want me to elaborate on?
Thank you, doctor. Thank you for that answer. Now we'll move on to our next question, which would be addressed to Dr. Nandita. So, Dr. Nandita, could you tell us the various categories of oral contraceptives currently available in the market and elucidate some differences as well?
Yeah, I think, Tarini, what we must remember is that if a patient wants to use oral contraceptive pills, I think the first thing they should do is consult a doctor. Not just start as an OTC, okay? Because there are many varieties which are available. Okay, we have these monophasic ones, which are the most common. Monophasic meaning same dose of estrogen and progesterone. What is oral contraceptive pill? Usually it is estrogen and progesterone combination, but there are also progesterone only pills, and of course there are some non hormonal contraception, but that's not oral. We are not using it in our country at the moment. Those are the latest one, new ones which have come. So the ones which are combination pills, which is estrogen plus progesterone, they have the same dose of estrogen and progesterone. That's called monophasic. Okay, then there is a biphasic pill which has a different proportion of estrogen, progesterone at different times of the cycle. The follicular phase, that is when the egg is growing, and then after ovulation, that phase. Uh, the Dr. Monika, can you switch mute? I don't know who's making. So the third one is a triphasic pill, which has the three different three different concentrations of the estrogen and progesterone, depending on follicular phase, the ovulation, and the luteal phase. So, depending on that, then there's a new thing which we use not only for oral contraception, but we use for problems like endometriosis, etc. Those are known as the extended pills, and those pills are the ones which can be used continuously. There's no bleeding, every monthly. We give it for 3 months. Usually we give it for 3 months, the pills. Now remember one thing, it's even good as an oral contraceptive pill because it prevents blood loss. A lot of 50% of the women are anemic in our country, so in those patients, extended pill is really nice. And the latest one more category which I really want to mention, because we use it in a lot of patients, is the low dose pill, which has the lowest dose of estrogen. Okay, the estrogen, the lowest dose causes less side effects. In fact, all these myths, I think you'll bust them anyway, but putting on weight and all is not there with these latest pills. So you have to understand these are the varieties. And of course, I wanted to mention the emergency contraceptive pill. The emergency contraceptive pill is actually a progesterone pill, and it has a very high dose of progesterone. So it should not be taken every time. It is what its name says, emergency, and it has to be taken within the first 72 hours after intercourse, because otherwise it doesn't act. The sooner you take it, the better it is. So these are the different varieties of pills. I don't think I've missed out anything, but yeah, I think I've covered everything. Kind of, those are the pills that are available, and the most common ones which we use in the market are the monophasic ones, and the low dose ones are very, very popular. And the progesterone only pill is used when the patient is lactating, or she has contraindications, like migraine and all. We use the progesterone only pills. And of course, um, in IVF also, the pills are used to kind of cycle the patients. So pills have multiple uses. Yeah.
Thank you, Dr. Nandita. That is a very comprehensive answer. So now my next question would be to Dr. Jamunadevi. Um, what prevalent misunderstandings or myths surrounding the usage of oral contraceptions, and how can these misconceptions be clarified or debunked?
You're muted.
Um,
You're
Dr.
muted. You're muted. You need to start the.
Sorry. So I think just now Nandita has already mentioned that women have that misconception of, putting on weight. And they think that even the fertility is affected if they take continuously these oral contraceptive pills. But that is not the case. And even they have seen that 90% in 90 days, they do get their fertility back after stopping the pills. And this is one of the very easy way of taking oral contraceptives, where even the coital disturbance is not there. But only one issue is there, that it doesn't prevent from the infections like STI and other infections, uh, because the other protection, they won't be able to take it. And one more issue is that they have to take regularly. As already Susheela said, it is effective only when it is taken very regularly, and they should not miss the pills. And if they miss the pills, then they have to use this emergency contraception pill to prevent pregnancies. And the other misconception is that infertility is one more thing they are worried about when they start talking about, like, if we start these contraceptives early, especially after marriage, then I may not be able to conceive when I want. That is also another misconception. So there should not be any worry about these things.
One concern is also about cancer, right,
Yeah.
Jamuna? Yeah,
Yes,
yeah.
I
They
think, in fact, they if they take oral contraceptive pills, they have that preventive measure against the ovarian cancers and endometrial cancers, colon cancers. These they have done a lot of studies, and they found that when they use these oral contraceptive pills, these cancer risk is very low.
And I think, one more thing which I really want to mention is when people come to my clinic, is if I give them oral contraceptive for other indications like irregular periods and all, they feel, why are you giving us? It's only for not having a baby. It needs to be explained, especially young adolescent PCOS girls. When we want to regularize the cycles, we give oral contraceptive pills. So oral contraceptive pills are not used only for not having a baby. They have other uses also. And another thing which people ask is, do I need to take a break, from the treatment of from oral contraceptive? So
yes.
far, none of our studies actually say that. We give a break because the patients are fed up of taking one pill every day. So in other indications, we do sometimes use progesterone. But I think for contraception, there's no need to take a break as such.
Yeah. Many practitioners themselves don't know that they don't need to take a break for
Uh-huh.
that.
Yes,
So
because
that
I think they
great
have
point.
the fear that patients keep asking the questions, no?
Side
So they
effect.
also feel that, okay, let me give a break, and then you ask them to use something else instead of that.
Yeah.
Even postnatal women also, when they come for contraception, because we don't give these POCs, we give progestrogens only, and they say that every day I have to take one pill. So then we have to give an alternative. Okay, you go for an injectable.
Yeah.
So, this is what happens. Okay, then we say that, okay, you take at least for 2 months, 3 months, you this progesterone pill, which doesn't affect your lactation. And then you can switch over when you're comfortable, either any IUCD or injectable, whichever is comfortable to you.
Comfortable.
Thank you, doctors. Now my next question. Firstly, welcome, Dr. Monika. Welcome to the session. And can you hear us?
You're
Yeah.
muted.
Doctor, you're on mute.
You're muted.
And frozen also.
I think our signal is a little bit of a problem.
Dr. Bhatia, can you hear us?
No.
Yeah. Could you unmute yourself? Yes.
Hello,
Well,
everyone. It was nice hearing all of you talking. I was actually in the OT, so I got late. Yeah.
yeah. Okay. So my next question would be to you. Yeah.
Yeah.
So, how do oral contraceptives influence the menstrual cycle, including alterations in the flow, frequency, and even associated PMS or premenstrual syndrome? I believe there's some technical issue.
Yeah, I think
Yeah, there's some issue. So, any one of you, would you like to take up the question?
we can all add a point or two.
Yes.
Oral contraceptives definitely make life easy as far as menstrual bleeding is concerned. Those women who do complain of heavy menstrual flow, and those women who complain of pain just before periods and makes their life miserable, they are not able to attend to their work. These are women who definitely will benefit from taking the oral contraceptive pills, and
Yeah.
especially the problems that they have in the premenstrual period is gets that much better with the use of oral contraceptive pills. Many a times we
Thank you,
do
Dr.
give oral.
Rani. So, oral contraceptives, as Dr. Nandita was just saying, can you hear me?
Yeah,
Am I audible?
Uh,
Yes,
Yeah.
Monica.
So,
yeah.
oral contraceptives.
I think
Yeah.
Her
you
signal
have to
is the
stop your
problem.
video, I think.
Stop your video.
Yeah.
Your signal
Monica,
is very weak.
weak. Yeah, if you stop your video, I think you'll be audible better.
I don't think she's online.
I think there's some issue. Dr. Susheela, I believe you can continue.
Yeah.
yeah, that's what I was saying. Quite often, we do give this oral contraceptive pills for the purpose of combating all this heavy menstrual bleeding, and for taking care of the cramps and the premenstrual syndrome, etc. There are some oral contraceptive pills with drospirenone as the progesterogenic component, which has got an anti-mineralocorticoid activity and is particularly useful for this premenstrual syndrome and all the premenstrual cramps, etc. So, in general, almost all the oral contraceptives bring down the amount of bleeding. Some women do get alarmed. Oh, doctor, I didn't have bleeding at all. What do I do after taking this tablet? So tell them that is the very purpose of giving these tablets to you. You should feel better. In fact, many a woman who's got anemia because of heavy menstrual bleeding gets the anemia corrected because of the use of oral contraceptives.
Yeah, I
Right?
think, yeah. Adding to that, I think even in endometriosis also, we
Yeah.
can give this oral contraceptive pills, and the dysmenorrhea, the pain, how they suffer during periods, it will be reduced dramatically. And as already Susheela said that when women come with dysmenorrhea and heavy bleeding, and we start these oral contraceptive pills, at the end of the first cycle, they are so happy, and they say that, and they're eagerly waiting to continue for some more time also. So that counseling also will be reduced because they themselves will feel that they are feeling better, and their problems are being solved with these tablets.
Also, there's another use regulation of the menstrual cycle. As I mentioned before, PCOS patients who have irregular
Yes.
periods,
Yeah.
those periods can be regularized. Then perimenopause, women have irregular periods and they're concerned about it. So these are the two places where actually it regulates the menstrual cycle. and not necessary for contraception, but it has its other effects also.
Yeah. And Nandita, don't you think it makes women's lives easier because they can plan when they can have their next period? They have a function at home, they need to travel somewhere, they can
Yeah,
pop an extra pill and manage to postpone their periods also,
yeah,
along
Yes.
with the option of contraception. So it's made
that is
everything a
something.
lot easier.
Yeah, I think people know that. We want to postpone pills, they come running to us that we want to postpone our period. So I think you're right. Yeah, that's one of the uses that is very good. I think, Dr. Monica, if you switch off your video, you'll be audible. You'll be audible if you switch off your video.
Switch off the
You're
video only. Switch
you're
off the
mute.
video only.
But am I? I've changed my connection. Am I audible now?
Yes,
Yes.
now
Yes.
you're better.
Okay. Hello,
Welcome.
everyone. I've been listening to you, but I think I was not. Yeah.
Yeah, welcome,
So I'm
welcome.
sorry for joining late. I was in the OT.
Yeah, Tarinee, you can go ahead.
We sort of
Yes,
ran
Doctor.
some there.
Yeah.
Okay, Dr. Monica, would you like to add a note, or would you like to add anything to the question we're discussing on the effect of oral contraceptive on the menstrual cycle and PMS, basically?
Yeah, I was just listening. I think everybody's. It has a lot of benefits. Everybody's discussed that already. Apart from giving contraception, reducing the flow, making the cycles regular, uh, reducing the pain, and and reducing the acne, hirsutism, all those are the non-contraceptive benefits. So yes, it does make life easier for women with particularly who are suffering from PCOS, endometriosis. Yeah.
All right. Thank you, Dr. Monica. Now, I'd like to actually ask the next question to you. I'd like to address it. So, are there any recent breakthroughs or noticeable research findings in the realm of oral contraception that have garnered attention for their potential to enhance efficiency or to reduce side effects, or any innovative methods of delivery that are better than the current existent ones?
Uh,
Yes. So
in
yeah.
sorry, whom are you talking to? Sorry, Monica, go ahead.
Yeah, sure. So yes, there have been lot of new developments regarding the dosing. We now have. We initially used to use a bigger dose of and now we are using smaller doses of estrogen that will produce a lot of side effects. Then we have newer progestins also. So we have third and fourth generation progestins, which also reduce a lot of the mood changes or the bloating and the breast tenderness side effects. So dosing, the type of estrogen, the type of progesterone that has changed. The delivery methods have also evolved over the years. Now we have simpler options which can be like vaginal rings or patches which can be used if somebody is not comfortable taking a pill every day. Then, of course, we have implants which have come up in a big way, and we have IUDs basically delivering the contraceptive, which is like LNG IUD, that's called a Mirena. So, a lot of new developments have been happening in this area, and which have reduced the side effects, which have improved the accessibility. And probably we will be looking forward to more such developments in the future.
Here I just want to add there are some non-hormonal things available like the gels and all, which are
Yeah.
spermicidal, etc. So these are very useful gels for people who don't want to take hormonal contraception. So these non-hormonal contraceptive methods also available. Of course, their failure rate is much higher than the oral contraceptive pill, but in patients where it's medically indicated, she has a history of thrombosis, she cannot take oral contraceptives and all. She has a bad migraine. You can then advise these kind of non-hormonal contraceptions also.
Yes,
So these are all
And
the
absolutely.
new things.
one
Yeah.
more thing I'd like to say is that the initial problem with oral contraceptive pills was missing the pill. You miss one pill and depending upon when you miss the pill, whether it is in the first week or second week or third week, a lot of confusion as to how to go about. Now we have and when to restart the next pack. Earlier it was take tablet for 21 days, give 7 days gap, and then again start the new pack. And a lot of women would forget to start it on time, and if you don't start it on time, the contraceptive efficacy remarkably goes down. So for this reason, now we have a 24 plus 4, and that means 24 active pills which has got hormones and 4 pills which are just placebo. And the advantage of this is the woman takes the tablet every single day. Even after 24 tablets, she takes one placebo tablet, and once the 4 placebo tablets are over, she starts off the next pack. So there's no question of trying to remember when to stop the pill and when to restart the pill. So that pill free interval which has to be 7 days and no more than 7 days remains that way. And in fact, the hormones are started much earlier. With this, the breakthrough bleeding is much less, the contraceptive efficacy becomes that much better, and the question of simplicity in tablet taking comes in. And therefore, this 24 plus 4 has, in all the newer generation pills are now 24 plus 4 pills. So there's no stopping the pills. You take one pill every single day, and that way you don't forget.
Can I add
And
something to it?
additionally, we have the
You know,
seasonal also, which we has to be taken 84 days. So women who don't
yeah.
want to have periods every month, they can opt for seasonal, which is like you take it, you have your period 4 times in a year. You take 3 months in a row continuously the pill. So that's another big advantage we have now.
Let me tell you about this, what Susheela was talking about. The 2 days ago, a patient came to my clinic and she was talking about this taking this oral contraceptive pill. She had an app on her smartphone which reminded
Yes,
her to take the
Exactly.
pill on time, everything. So I think the Gen Z is really lucky. They have all
yes,
these kind of digital tools to help them. So it's
yes,
really amazing. I knew such things existed, but I didn't know that people were actually using it.
yes,
So yeah, they are all using all these apps and all. So besides making the pill every day, also the timing and everything, the app actually reminds them. Their phones, the smartphones tell
yes,
them.
correct. Yeah.
It's
Smartphones.
amazing the way
And
technology has, added to it and made things. And all these rings and all which Monica was talking about, actually, 1 year you can keep it. So
yes,
there was no question of taking it every day or something. But they are not available in our country yet. But I'm
yes,
sure they will become very popular.
Yeah.
because they have to change every month. That is one
Every
difficulty.
month.
Women
Yeah.
feel it, and they don't want to place it by themselves. They
Hmm.
have that fear.
Every 3 weeks.
So
Every 3 weeks. Yeah.
that's the reason I think rings did not take up in our country.
And
But
cost.
Marina has taken up very well.
Yeah.
Now we are not doing permanent sterilizations. Now we are
Yes.
advising them this LNG IUCD so that they can change it every 5 years. And once they are 44, 45, then we say, okay, you don't have to. Maybe you can go in for other hormonal pills.
Yeah, not many people may know that when a copper T is placed around the age of 40, it need not be removed after the expected period of
Yes.
time. If the expiry date is for 3 years, they need not remove it after 3 years. They can
Yeah.
keep as long as they go into menopause. So,
Yes.
and that is not my recommendation. That's the recommendation that
Yeah.
is
I know.
the WHO. So
But
it's good.
most of our women don't like it, Sushila. They will tell that, no, the date is
Yeah.
over. Now I think it is expired. Why should I have that foreign body in the body? So please remove it. They themselves will come and say that, no, we don't want to. And I think in socially and culturally, some of these Muslim ladies, when they go to Hajj, they don't want the period to be for 2 months continuously because it is 40 days. So I think this I mean, pills also will be helpful when we can prescribe them. And now I think even for marriages, they come to us and they want to plan accordingly with those pujas, this, that. And so we have to manipulate those
Yeah,
dates and give
like
them the pills.
Like Nandita said, it is very, very helpful to regulate the menstrual cycle. Yeah.
Yes,
For
yes.
her, in her IVF practice, it is particularly useful, right?
Absolutely,
No, for
absolutely.
us
All
also, especially when
literally
they
are.
come for, with such demands.
Yeah.
Yeah.
All right. So I'll my next question is to Dr. Susheela. So can you expand upon the advantages and disadvantages of the various oral contraceptive options and talk about what factors should be taken into consideration while choosing one option over the other, its usage, its adherence, etc.
Yeah, like it is not like one option is suitable for everybody. That is why we have a cafeteria approach as far as oral contraceptive pills is concerned. We won't be using the same kind of oral contraceptive pill that we use for a 20-25-year-old woman, and what we use for a 40-year-old woman would be definitely very different. We are looking at the kind of estrogen, the amount of estrogen, the kind of progesterone, etc. For a woman who is around 20-25, we would probably use a contraceptive pill that contains ethinyl estradiol of 30 micrograms and say probably levonorgestrel of 75 milligram. But then this is something which has been used for many years and has proven its advantage. It's very, very reasonable also cost wise, so we won't think twice about it. So this is the combination that we would advise in a younger woman. Say we have a woman with polycystic ovary, then we would want to choose a different kind of progestogen there, something which has got less androgenic effects or no androgenic effects and has got only progestogenic effects. Say, for example, earlier we were using a combination of ethinyl estradiol and cyproterone acetate, which is like an anti-androgen, and therefore it brings down the androgenic side effects. But then now we have got another generation, which is spironolactone derivative called drospirenone, and drospirenone, in addition to having anti-androgenic effects, it reduces acne, it reduces hirsutism that is there in PCOS women, and therefore it is very useful not just to regulate the menstrual cycle, not just to bring down the menstrual bleeding. It also brings down the acne when it is used for a period of about 6 months or more. It can reduce hirsutism when it is used for a period of 6 months. And oral contraceptive pills themselves can be used as a treatment for these problems of PCOS. I'm talking about regulation of menstrual cycle, I'm talking about acne, I'm talking about hirsutism. So these problems, which are extremely common these days, can be handled very well depending upon the kind of progestogen that is there in the oral contraceptive pill. Now, if you look at a woman who has reached the ages of 39, 40, one would be a little wary of using a estrogen which has got 30 micrograms. And if at all you are using an oral contraceptive pill there, I would probably look into something that has got a very low estrogen component, something like 20 micrograms, and now we have even 15 micrograms.
Yeah.
So, this way, I would probably choose my user who is going to use, and especially if they have a tendency for diabetes, if they have a tendency for hypertension, I would use something which has got a very low hormonal component, provides contraception, provides regularity of menstrual cycles, yet again doesn't disturb the lipid profile and the carbohydrate glycemic profile. So all these things can be taken care of by choosing the correct combination for the correct user. My friends might add some more to this, but this is how we go about it generally.
Any of you want to add anything to what Dr. Susheela said?
I
Yeah,
think,
I think she's covered
yeah,
everything. Yeah.
yeah,
Jamuna, you want to talk
yeah, yeah.
about the progesterone
No,
only pills?
no, no, you please talk. No problem.
Okay, progesterone only pills are the ones which we use when the patient is pregnant, lactating, and she needs to use contraception. And remember one thing, that old myth of you cannot conceive when you're lactating is not true. People do conceive when they're breastfeeding. So that's why the contraception is needed. Secondly, some patients cannot tolerate the estrogen, because of migraines and all, and they don't want to use copper tea for various reasons. So then this is one of the choices which we give. As she said, cafeteria approach, meaning we have a menu, and we select out of the menu what suits you the best. So that is what the cafeteria approach is. And of course, the emergency pill, as I said before, it's very good. It's fantastic for those who don't, but you should not have an emergency every month, maybe 3, 4 times in a month, or every month you take those, because they are high dose of hormones, and they can, little bit upset the cycle. But otherwise, I think we have fantastic pills today, and they are the ones. In fact, this is a statement which I love to make, that it was one of the discovery of the oral contraceptive was the most important discovery, because it empowered women. It gave them control over their reproductive function. Otherwise,
Yes.
before these were discovered, women were just getting pregnant and producing 10 and 15 babies. So it's one of the women empowerment things which has a lateral side effect of women empowerment. Very important.
Yeah.
I know.
Very, very well put, Dr. Nandita. Like, actually, um,
Yeah,
yeah.
yeah. The
So,
discovery of
yeah,
pill
yeah.
was something which made a whole lot of difference to women, especially in managing her fertility status. Otherwise, each time they would have to depend on men to use condoms. Till then, this was way
Yeah.
back in 1960s and so. So
Was
now
it
it
in
made a lot of difference.
60s? Okay.
And then progesterone only pill also is useful in perimenopausal women where you don't want to use
Yeah.
estrogen component. So that was very well asked, Nandita, about the use of progesterone only pill. Yes.
All right. So, now, thank you, doctors. And now, my next question is to Dr. Monica. Yeah. So, in what ways do cultural attitudes, societal norms, and access to healthcare services impact the utilization and acceptance of oral contraceptives?
Yeah, yes, Dr. Tarinee. So, India is a very diverse, culturally diverse country, and we have different cultural and religious beliefs. And as Dr. Nandita just spoke about women empowerment, and yes, we are, yeah, looking towards that, but then we still have a lot of rural population who do not make their choices still. So it does influence their reproductive choices. And in fact, access to healthcare may not be, you know in the educated ones, yes, access to healthcare is easy, but for the rural women, even access to healthcare may not be that easy and simple. So things like, beliefs like using contraception, they can be strong opposition to using contraception totally
Yeah.
in Indian families. Like so, education plays a very important role. Education, in fact, is the best contraceptive for women. So they now control, they can control their family size. But then we are talking about the empowered women, but we still have, in India, millions of rural women who still don't have that control on their reproductive choices. And then there are a lot of stigmas and taboos as well, as in discussions about reproductive health itself can be associated with shame and embarrassment, and so they do not really come up in India. I don't know why. Even menstruation now, it's just in last few years we have started speaking about menstruation so openly. Usse pehle we were not even doing that. So that's one big thing in India. I think we should all come forward and start speaking about it openly so that women can take these decisions on their own. And gender dynamics, in India, being a patriarchal society, women don't take the decisions only, so that also influences their choices. And yeah, and socioeconomic factors and education, so all this influences contraceptive choices. And we should all, I think, as a society, as women, we should all work together to empower women more so that they can make these choices on their own, right?
Yeah.
Oh, the other day in the clinic, one patient, postpartum patient, her mother-in-law comes in. and I was talking to her about the property and everything. She's the one who's making decisions for her.
Yes,
I mean,
Yeah,
yes,
educated
absolutely.
people in
Absolutely.
the
Agree.
city. So I think
Yeah.
women need to really take decisions for themselves and get empowered and talk and get hold of the control over their bodies. So
yes.
Absolutely.
it's really sad to see this kind of a thing happening. And
Yeah,
some
that
of
this is from educated women.
the
Yeah.
people still
Yeah.
don't allow the girls to touch anything in the house when they have periods. You touched upon periods, Monica, but they
Yes.
don't even allow them to touch things. They have to supposed to sit in a corner and all. I mean, it's
Yes.
really. I think those things really need education and change of attitude.
And
Absolutely.
now,
And
Another
religious beliefs, the religious beliefs, the like certain sects don't believe that contraception should be used, so they are prevented. They don't
Right.
take it. So all those cultural beliefs are there. We have to look at those things also in mind when a couple comes to you, what their religion permits or not, because in
one
IVF
more.
it's a lot of those things.
Yes, I know. But one more thing I would like to add is that now we get so many unwanted pregnancies coming for
Yes.
abortion, despite saying that this could be avoided, especially even postnatally when we counsel them that before you join your husband, come back and discuss about the contraception so that you don't become pregnant and don't go for abortions. In spite of saying that, still they come with unwanted pregnancies and they land up in abortions. And we try to empower that girl. It is you who's going to face all these things, not the husband, not the in-laws. None of them will face. So you have to take the decision of what contraception you should use as soon as you have your delivery. So we keep on saying this, but still the woman doesn't take it. And now this
Yeah.
living in relationships also has now become such a menace. They come for unwanted pregnancies, and they come for abortions, and they take now, of course, medical abortion. They themselves take as a OTC, and they come back with a lot of bleeding and all those issues, and they never come to doctor to find out like, okay, you are living in fine, but at least you learn about contraception and follow it so that you don't get into that unsafe abortions and unwanted abortions.
Jamuna,
Yeah.
OTC,
That
point
epidural
about
pill is not OTC. They
it's
cannot
not
No,
take
a
it.
they
yeah,
are
it is
It's
getting.
illegal.
illegally.
It's
It's
No,
illegal.
obtained illegally.
that's what I'm
But
telling
it's
you.
available.
Illegally they take, but they
It's
take from the
illegally
pharmacy.
available. Yeah.
They
It's
take
available
from the
illegally.
pharmacy.
can I make
Illegally, mother, they take from the pharmacy, Monica.
Yes,
Yeah,
absolutely. Yes,
can,
yeah,
yes, ma'am. They
illegal.
take it from the
The
farm.
pharmacy fellow sells the medication to them.
I think I'm glad we
Absolutely.
are talking on this forum about how dangerous they can be when they are not
Yeah.
supervised by a gynecologist.
Yeah,
I think
so
yeah,
this is
many
an
times we
important
come,
message
we,
you need to
yeah,
give everybody.
and so many times we are managing ectopics, chronic ectopics because of that.
Yes.
Because,
Yes.
yeah, yeah,
True.
if I may say so, another aspect when we talk about cultural thinking and contraception, world over, the acceptance of oral contraceptive pills is relatively high. I won't say it is very good, but it is not too bad also in the European countries and even in the Far East countries. Having said that, for many, many years in India, even through the national programs, we have been having oral contraceptive pills distributed right down to the primary health centers.
Yes.
But it has not been accepted because somehow they don't like popping in pills. On the other hand, they don't mind taking injections. So
Yes.
you find a lot of women coming and asking for injections. See, the mentality, Indian mentality is such that somebody has fever, they go to the doctor and they'll say, "Give me a shot and I'll be all right." So they take
Yes.
a shot of whatever the doctor gives, and they feel that does wonders. I do tell them whatever injection is given, it works only for a set number of hours, and after that the effect goes away. But they feel that it does all the magic. The same with contraception. With oral contraceptive pills, they are not all that keen on taking. Only 3% of Indian women use oral contraceptive pills, whereas the injection has found better acceptability. One, because they need to take it only once in 3 months, and
Yes.
two, They need not let their husbands or the rest of the family know they are taking injections. So
Yeah.
they in our country, injectable progesterones have found better acceptance than oral contraceptive pills. I would say that is because it's a mentality. Injections are any day better than pills.
That's a completely different perspective from what we see, you know. So it's such a different set of practices. I think,
Yeah.
the lot of I don't see that many people taking in injectable. They're more
Both
into oral.
asking for injections, Nandita. Lot of women do come asking for injection. They say
Yeah.
they have taken injection and they have taken it 3 months back. So please give me a repeat of that injection. They
Now,
do get from
now
this one. Even
the government,
educated take
Yeah,
injections.
yeah,
Yeah.
yeah.
now the government is supplying, isn't it?
And
Yeah.
now for a long time, government
Yes.
is supplying.
So
Depot
that
Provi.
way also, I think they are well versed with those pills and injectables. Now, I think even the implants they are being
Yeah.
used. Now it's a big way, and in fact, in Hyderabad, in one of our organization, we have done 15 implants, and all are lower middle class,
Wow.
not
I
educated. I'm telling you.
I would like to share here that I was waiting for the implant to be introduced in India because I had an extremely fertile woman who belonged to a community where contraception is a taboo. And she would come to me for delivery after delivery. And when I did insert a copper T without her husband's knowledge, she became pregnant with the copper T.
Oh,
So so I was waiting for the implant to come, and she was my first patient. This happened several years back. She was my first patient, and now she tells all the others about implant. So I don't have to coax or tell people about it. So it makes a lot of difference.
Yes. Yes.
So
Acceptance to
we
implants is very good now.
we also have a question. So I believe Dr. Nandita spoke about gels. So there is a question about the effectiveness or the percentage efficacy related to the gels in comparison to the oral contraceptive. How
see,
effective they are.
see, the oral contraceptive is like 99% if it's used correctly, and maybe 91 to 94% if people miss it. The gels also have to be used properly. And if they're used properly, it's like about 70 to 80%. So they're definitely lesser than the uh,
Oral contraceptive.
oral contraceptives, but they're equally good if it's an emergency, you keep it with you, you can use the gel. I think that is something which women are comfortable with also.
All right. So now I request all the doctors to give a closing remark in the form of an experience or just something that they would want to share with the audience. So we can start with Dr. Jamunadevi.
Yeah, I think I had an experience of, counseling a patient immediately after delivery that you please come back for contraceptive decisions. And then after 2 months, because after 42 days, they come back or they go to their in law's place. So that lady, I mean, she came in and I discussed with her all the cafeteria of contraceptions which are suitable for her at that time. And then she says, okay, I have to discuss with my husband and discuss with my in-laws and then come back to you. And okay, I said, but do it this very immediately, so that I don't want you to go for unwanted pregnancies and come to me for an abortion. And after 4 months, she comes back for an MTB. So I was telling her, despite of my counseling and explaining to you what was the reason, you have come back with the same problem, which I wanted to prevent, so that you don't face such things. So women sometimes, I don't know, like still they depend upon their decision on the husband. Whenever they come to us and we ask, when was your last period? Then she'll just look at her husband, so that looking for an answer from him. It's so sad that, so I always say that it's your period, you should know what's the date, how come he knows? So these are the things. Still, they don't take the decisions for themselves, or I don't know whether they don't want to know that they can take the decisions. I think one has to learn to take decisions and at least understand what are the various uh, factors are there, and then you discuss if you have any issue with that, and then take a decision. I think this is what I would like to tell all the viewers.
Thank you, doctor. Now moving on to Dr. Nandita.
I think I echo Jamuna's sentiments. What I would like to say is own it. Own your reproductive cycle. Own your reproduction, because it's very important. I think for the even the government of India has given the right to the woman that she can terminate the pregnancy if she wants without the husband's knowledge. I mean, without the husband's permission. So I think it's very important for girls to understand, and especially young girls. I want to address over here. They're sexually active at a younger age now, and they need to understand that contraception is very important, because unwanted pregnancies can lead to problems later on. You don't conceive, etc. You get different problems. So I think contraception is very important. It should be explained to college. There should be education in college for all the girls, and also their mothers, because it is not harmful. I mean, that myth has to be busted that contraceptive pills are harmful. This is the fourth generation of the pill, which is absolutely has less side effects. So it's fantastic. So don't be afraid of the oral contraceptive pill. This is what I want to say. Don't be afraid.
Thank you, Dr. Nandita. Now, Dr. Susheela.
Yeah, again, both of them have put it across extremely well. I also tell the woman that she needs to take responsibility and she should not wait for her husband to give his consent. In fact, if she doesn't want to have any more children, it is totally her decision and not even depend on what he thinks is right. But that is what we say, and how they follow is very different. You can only coax them to some extent, use a little tough love when you are talking to them, and tell them, but ultimately they will change only when they decide that they are ready to change, I suppose. Having said that, what my understanding about this contraceptive choices, many years ago we did a study to find out if counseling that is talking to women about different contraceptive choices helped to improve the contraceptive uptake. That means you need to spend at least 15-20 minutes of your time to talk to them, and that particular study did show that it makes a lot of difference. What they choose, but then it becomes an informed choice for them. So after that study, I have one nurse trained to run through the pages to show different pictures, and she does all the counseling. And I ultimately, if they have any doubts to ask, I address. Has it improved the contraceptive uptake? I don't know, because my practice is a small practice, and I don't know whether it has really made that huge a difference. But definitely, what I would like to say is that the number of women who are using oral contraceptives has not changed remarkably over the last few years. Though we have different varieties of contraceptive tablets that are available, the number actually those that are using has not remarkably changed. Even if they do use oral combined oral contraceptives or even the progesterone only pills, it is not for a very long period of time. The use of LARC, that is the long acting reversible methods like the injectable contraceptives, the progesterone intrauterine system, or for that matter, the implanon, all these have increased considerably over the years, and not so much the oral contraceptive uses.
Thank you, Dr. Susheela. Now, moving on to Dr. Monika.
Yeah, so I think everybody's covered almost everything, but I would just like to add that, like as a society, our women do get influenced by surroundings, and because of not having enough knowledge and information, they make these reproductive choices which may not be the right ones for them. They do get influenced by, say, mother-in-law or husband, who themselves may not be appropriately educated. So probably we should work more on educating women. As just ma'am said, in the colleges, I should say, right from school, and keep reinforcing it again and again, because it is the reproductive phase itself is a very long time, from 15 to 45 years. It's like almost more than one third of your lifetime you have to make these choices. So maybe re-educating them again and again about the different options available, because we have not just the pill, we have the mini pill, we have the injectables, we have the implants, we have the IUDs. So we have so many options. So according to their needs, their preferences, their medical history, we can offer so much to them, and which is going to prevent, unwanted pregnancies, sexually transmitted infections, and so much, and improve their overall quality of life. So it is those stigmas and taboos we need to overcome as a society together. I think that's what can be done, because why in India we are not using so much of contraception? It's all because of lack of education. Even the so-called educated society is still a bit scared about using all these methods, because of, again, lack of awareness. So I think we have to, as a society, work together on improving the education, improving the awareness. Then we can bring about a change, maybe. Yeah.
Thank you, Dr. Monica. Would any of the doctors like to say anything before we conclude the session?
Say what, Tarinee? Come again?
Anything they would want to add before we conclude the session?
I think we have said it all. We have said it all. For the listeners, definitely we would like them to implore that contraception is a woman's prerogative, and she needs to decide on the kind of contraception that she wants to use for the period of time that she wants to use. And there is no excuse for not using contraception because of the umpteen options that are available in the market. So she should, it's like, having the right to vote. She should have the right to decide on her reproduction. That right, she needs to take it in her hands.
I think it's the need of the hour.
Yes,
Agreed.
absolutely. Yeah.